Well, diabetes was the most expensive chronic illness in the U.S. in 2017, with a total of more than $327 billion per year, including $15 billion for insulin. That's according to the American Diabetes Association. In fact, the average price of insulin nearly tripled between 2002 and 2013.
Our Olivia Leveda joins us live from our Killeen newsroom. Now, Olivia, you spoke to a Central Texas woman with type 1 diabetes who says she feels the real-world effect of those price changes.
Janice Wall lives in Temple, and she says over the last few years, the cost of maintaining life with the disease has increased.
For the last 25 years, Janice Wall has lived with type 1 diabetes.
Immediately was thrust into insulin injections.
Type 1 diabetes patients are reliant on insulin. Their body in general does not make enough insulin, and if they don't have access to their insulin, they can become very sick.
Wall must constantly manage her blood sugar levels.
365 days a year, 24/7. Unpaid job.
And she says over the years, the cost of that maintenance has increased.
On my insulin alone, I was spending $100 mid last year. It went up to $120, same insulin, same amount. And this year I've been quoted, and I'm going to have to order next week, $237. So almost doubled in less than 5 months. My co-pays last year for medical expenses was $6,000, and about $1,000 of that was insulin cost.
Wall recently visited Washington, D.C. with hundreds of advocates to advocate for affordable access to care for diabetes.
And I visited with my Congress people.
And earlier today, the American Diabetes Association's Chief Scientific, Medical, and Mission Officer, Dr. William T. Cefalu, testified on the rising cost of insulin before the Oversight and Investigation Subcommittee of the U.S. House of Representatives Committee on Energy and Commerce. In a statement Cefalu shared with us, the ADA remains steadfast in our efforts and work with Congress and other leaders to find long-term solutions that will ensure affordable access to insulin for all who need it.
You know, we're hoping that every patient with diabetes can have access to insulin.
It gives me hope, and it gives me hope for all the 30 million Americans that are living with this.
Advent Health Central Texas officials did share that if you have trouble paying for your insulin, you can reach out to your local hospital and they may have resources available to help. In Killeen, Olivia Leveda, Central Texas News Now.
Olivia, thank you. According to a report from the ADA, cost of diabetes increased by 26% from 2012 to 2017. Officials say that's due to the increased prevalence of diabetes and the increased cost per person with diabetes.